we're at a unique situation, if we want to talk about silver linings, where people are deeply engaged with their own risk profiles, with their exposures, with their own safety. And this could be a really fantastic opportunity to get more buy-in, really change the minds and hearts about general safety behaviors rather than solely COVID-related things, and using that as kind of the lever or that kind of first cut in. So very excited to explore that a little bit more. And you're gonna go ahead and hide this one. We'll probably come back to it a little bit later as we get on, but thank you everybody for joining us. It is 3:05 p.m. Eastern time, now in Central, and our webinar is going to get started. So thank you for joining us for today's Community Connection webinar. Today we're going to be talking about the impact of COVID-19 on risk assessments. We have with us today Sean Fitzgerald, Trent Peacock, and Meghan Seltzer. And these webinars are a chance for people across the environmental health and safety community to come together, share ideas, talk about problems that they're having and solutions that they found, and really just have more opportunities for kind of cross-pollination and connection at a time when a lot of us are still working from home, working more isolated, not seeing our teams as often, and trying to spend a little bit less time reinventing the wheel and more time really putting these practices into effective use. So without any further ado, we're going to go on to our main slide and meet our panelists. So if we could just have you all kind of go down the line, introduce yourselves, talk a little bit about where you're working, and then we can get into the, and tell us a little bit, I guess, about your definition of the term risk assessment, and then we can get into the Q&A portion here. Not live, that's coming up later. And a quick reminder to all of our attendees, there is a special Q&A feature in Zoom Webinar if you haven't used it before. So if you go down to your Zoom toolbar, there is a little Q&A button. You can click on that, and then you'll have a separate window where you can ask your own questions, and it'll be easier for those to be seen and addressed. You can thumbs up the questions you're most interested in, so that way we know what to prioritize during the live Q&A portion of the webinar. And you can also reply to each other's questions. So at any point, if you think you have an answer, something to build on, an idea, or you're just interested in the response as well, you can add that and you don't have to wait for us to address it. So enough for me. Sean, would you like to say hello?
Yeah, sure. Hi everyone. I'm Sean Fitzgerald. I'm the Institutional Biosafety Officer and really sort of the EHS point of contact for the Hackensack Meridian Health Center for Discovery and Innovation. We're a small startup institution, kind of as a huge healthcare conglomerate in New Jersey. We sort of bridge the gap between the research entity and the hospital entity here. Previously, I'd done research and safety at Harvard University and also at Tulane University before that. I guess to sort of wrap up my risk assessment statement, I really try to look at risk assessment as a process that looks at safe and effective solutions for risk. Looking at my colleagues here in the panel's definitions too, I think it's an iterative process and a cyclical process that never ends. It's constantly evolving, and it has to be safe, but also be effective, or it's not going to be accomplishing the goals of the researchers also.
Okay. And Trent?
Okay. Hi, my name is Trent Peacock. I am the Institutional Biosafety Officer for Mississippi State University in Starkville, Mississippi. Prior to this, I was in active duty military. I was a research microbiologist and biosafety officer, regional biosafety officer for the Biological Select Agents and Toxins program. And risk assessment, obviously for me, is definitely a cyclical process. A lot of my experience with risk assessment, and part of the reason why the definition is the way it is because of my career in the military, because we deal with risk and risk assessment and risk management in multiple facets and in multiple ways.
Great. And Meghan.
Hello, everyone. My name is Meghan Seltzer. I am one of the managers of safety, health, and security at Howard Hughes Medical Institute's Janelia Research Campus. We are located in Ashburn, Virginia. We are relatively small compared to big academic research centers. Thankfully, I only have one building to manage, which makes my life a little bit easier. But I think that also fits into my outlook and perspectives on risk assessment as well. To add to what both Sean and Trent have said, I think a key to risk assessment for me and how I like to approach them is very collaboratively. I tell my researchers all the time, I'm going to know things about how to protect them that they might not know. And they're going to be much more familiar with their research and their processes and what they need to accomplish than I am. So really, we kind of need to come together and come to a solution that is going to not only protect them, but is workable. And without their perspectives, we can't get there. So I really think risk assessments need to be done collaboratively, but they also need to be done objectively. Part of the challenge with risk is that everyone has different perceptions of risk, and humans are really bad at actually understanding what the true risk of a situation is. So trying to base it as objectively as possible in the facts that you know kind of sums up how I like to approach it, but I also understand that's not always possible, and COVID-19 is a great example of how sometimes you don't have the objective facts to base decisions on.
Yeah, and I've definitely also seen a good number of people having a very hard time understanding how there can be acceptable amounts of risk, and instead kind of going crazy to try and reduce their risk to zero, which I think is a pursuit we're all a little familiar with. So just to kick things off here, I'd like to ask all of our panelists, has COVID-19 made it easier to get other individuals engaged in performing risk assessments? I think that we are all, certainly like I mentioned earlier, having to think about this idea of risk, about when you see somebody, how you see them, how does that contribute to the concept of being exposed? And then of course, as we're performing our normal risk assessments, is that familiarity making it easier or harder? So go ahead, take it away. Sean, if you want to kick this off.
Yeah, I think, we try to preach to people that perform these risk assessments constantly in, all their different various research environments. And, we get some people that commit fully, but we have a lot of people that sort of probably, yes us away, and then they move on and they do the bare minimum what they need to do. I think the reality of this pandemic is definitely put the idea of at least infectious disease risk assessment really in the forefront. And I can't tell you how many conversations I've had even on a personal level with people sort of describing risk assessment in their daily lives. I interact with this person, I go to this place. How does that change my risk? And it's really helped elucidate what goes into a risk assessment, what goes into risk analysis. And I think it's really had a great effect on the people I've interacted with in the research environment, because I think they're sort of realizing more and more the importance of risk assessment, not just in their daily lives, but also in the work they're doing, and sort of committing to that more fully, I think. And so I would say it's made it a lot easier to sort of convey the importance of risk assessment and get honest risk assessment occurring within the research environment.
Great. Trent? And then, of course, just as a quick aside here, if any of you would like to respond at any point, just kind of jump in and hear something that kind of clicks something up in your head, please, by all means.
Okay. Thank you, Matt. And my response parallels that of Sean, and most likely will parallel that of Meghan, and most every biosafety professional who's serving or has served in these types of positions. And for me, working on an academic campus, working with researchers who've been here forever and swear that they know everything there is to know about everything, they're now beginning to understand, and I think so in real time, what the consequences are, and I'm just going to put this in quotes, but when containment is lost, right? And so whether we're trying to from an infectious disease perspective, contain it in the lab or keep it out of the lab, there's some level of containment. We're trying to prevent transmission from person to person. We're trying to minimize, somebody at work going home and they've been exposed and now they're going to expose their family. And being able to have these conversations with the PIs in real time about SARS, and then relate that directly back to the kind of work that they do in the laboratory, I think it is allowing them to see the bigger picture and why it is I see them and I sit down with them and we go through a risk assessment together, and I talk them through it and I show them, well, this is what it looks like for your research. And I think they're beginning to see that. And I think it's beginning to hit home simply because most everybody has been affected by COVID-2 in some way, shape, or form.
And Megan.
Yeah, so I'm going to try not to sound like a broken record with Sean and Trent, but yeah, I think the situation we're in with COVID-19 has made conversations about risk assessments a little easier. I think that a lot of terms we're used to in the safety field hearing and dealing with, you know, the EPA listed disinfectants, PPE, proper use of PPE, disinfection, those are all things that are now kind of common terms that are used by the majority of people that we work with. And so I think it's given them a little insight into what we've dealt with on a day-to-day basis. I think in some ways, however, it has made things a little bit harder in terms of risk assessments for other things, because I think people are so laser focused on their risk related to COVID and their risk related to interacting with other people that they sometimes need to be reminded that that's not the only risk that they're encountering in the workplace. They're still working with chemicals. They're still working with animals. They're still working with other materials that might be hazardous. So it takes a little bit to remind them that they need to not be so myopic and just focus just on COVID, that they still have a greater risk profile when they walk into the building at the beginning of the day for things that they're always working with and always dealing with. So it's made it easier to talk about it. And I think moving forward, it's a great tool to illustrate a lot of the concepts related to risk assessment, but it's been hard to keep people, you know, aligned on the bigger picture as well about what's going on, you know, at the bench that's probably in all reality more of an immediate risk to them than COVID at that moment.
Yeah, I've definitely heard that one from a few of our past panelists, that people just get so laser focused on, you know, COVID. They forget that their, you know, sleeve is touching an open flame. So just a great reminder. And also, you know, hopefully using that lever again to get people saying it's great that you're concerned about this. Like, let's look at the other risks and help you understand. Maybe that's the big part too. I think, you know, Trent, you touched on this a little bit earlier, that people work in the lab, and this happened for me as a former researcher. You work in the lab around these things for so long, and humans just naturally become kind of baseline to whatever risk they're working with, to the point that they become background. And just getting that reminder of, hey, you're concerned this much about COVID, that's great. If you're concerned this much about COVID, let's show you the other things that are around that could hurt you. And then maybe that's a great way to let them look at things with new eyes there. And then Megan, I have another question for you here. So have you encountered a situation where you needed to assess a risk that was particularly open-ended or unclear? And what did you do in that situation?
Yeah, so, I mean, it's the elephant that's everywhere. I mean, the entire situation related to COVID-19 has been a big unknown. And it serves as a great example of how we need to be agile and responsive to these unknown risks. But I think that in my day-to-day job, you know, when you're working with scientists that are pushing the envelope of science, they're always working with new technologies where you don't fully understand the risk that's out there. So a lot of it is trying to get as much information as you can and as many perspectives as you can about what's going on. So, you know, using COVID as the example, at the beginning, as information was starting to come out, you know, I feel very fortunate to be a member of APSA International and have those resources available to send out emails to people and say, hey, how are you guys dealing with this? What do you know that I don't know? Do you have any idea about this one particular thing? What are the risks? Where is the knowledge that I need to answer this question that's in front of me? So whenever there's a risk that you don't have readily available information, drawing on a network of people is really critical. And it's not just, the network of safety professionals, it's also really having those conversations with the researchers or the individuals that are exposed to the risks to understand what they know. I think that the journals and all of the preprint servers that have been out there with COVID have been very helpful to kind of get the information a lot faster than you normally would related to certain risks. So it's just being adaptable, being agile, and being open to when you don't understand the risk fully. I think the last thing any of us as a safety professional want to do is come in and say, this is absolutely correct. I find it very helpful to acknowledge and say, hey, this is my understanding of it based on the knowledge that I have, and that's going to change, and I may be wrong, and I'm okay being wrong, but this is what I think we should do based on the information that I have. What do you think? And I never leave it as like, this is the edict, this is the final, because that dialogue is so amazingly critical to get to a good solution. So it goes back to what I said at the beginning. You gotta talk with people. It's a crowdsourcing effort to really get at those unknown risks.
Yeah, and I just want to add quickly to what Meghan said. I could not agree with that more. I think the ability to just state, this is a new and evolving situation. This is a new and evolving pathogen. We're learning more about it every day. This is where our current risk assessment stands. This needs to be a process that'll continually evolve with the information evolving. I think early on people were looking for, distinct, clear-cut, written in ink answers. And I think even right now, as we sit here on September 10th, we're still learning new things about the pathogen. So I think there's still a lot to be determined. And I think that, Meghan, I could not agree with that more. I think that's the most important part, to really have that ability to let people know that, no one is a complete 100% expert in any of these things. We need to work on this together and come up with a good solution.
Great. Well, Sean, I have a question for you here after that one. So have you hospital partnered research labs have unique opportunities and also unique risks. Has this resulted in any particularly challenging situations for you from a risk perspective?
Yeah, I think we have a very integrated network, which is provide a pretty significant repository of patient specimens. And one of the most challenging tasks is, we were in one of the hardest hit areas early on in the pandemic. We had a lot of patients in our ICUs. We have 17 hospitals. So we have a massive biorepository with specimens from all of those patients, catheter tubes, tracheal tubes, aspirates, excretory samples, blood samples, everything under the sun coming from these patients, coming from all these patients. And it's showing up in big bulk shipments. And it's sort of like kids on Christmas. Everyone runs to the package and everyone wants to do 300 different things with everything that's coming out of there. So it was really a matter of, bringing the groups that wanted to do this research together collaboratively and discussing, well, what are your research outcomes? What are you trying to determine from these specimens? And then start walking back from that to the actual processes they're doing. Is there a potential for propagation? What level are you going to be doing this? Who's going to be doing this research? What are your outcomes? And really trying to look at all these projects holistically to see what they're trying to accomplish, but also at the same time, making sure that we're meeting all of our, sort of requirements and regulatory pieces that are out there pertaining to the virus. So it became an environment where, sort of teaching people on the fly how to really do a very comprehensive risk assessment, but also ensuring the fact that people understood the gravity of what they were doing and the importance and the danger of what risk could occur. I saw one of the questions was mentioning, how to convey risk, to people in environments where, they say they're following the rules, they're following these things. And I think it was a matter of determining, what are these scenarios that could occur, presenting, problem scenarios where, risk is escalated, and then really trying to convey how we can mitigate that appropriately. And that was really the biggest challenge, and it's still ongoing. I mean, we're still getting new samples, we're still getting new specimens, and still new avenues of research. So it's been good for the institution, but definitely a tough task to continue to convey those messages appropriately.
Great. And Trent, next question is coming your way. So with misinformation and fear about coronavirus running rampant, have you found any effective strategies for keeping risk perceptions reasonable and grounded in reality and not just sort of ballooning out of control?
Oh, sure. Part of my answer, actually, an explanation, is going to touch a lot on what Meghan had already said. But one of the things that I try to do is I keep it simple and I keep it relatable. The last thing you want to try and do when you're trying to, at least in this environment, the academic environment, and even at the personal level, I've had to do this, try to explain, what's going on or why something is happening, or, well, what do you think about this? And keeping it simple and keeping it relatable to the individual you're talking to the question that is at hand is critical. The other thing is keep it concise. The worst thing that you could possibly do right now or in any other risk-based type of situation is overdo it on the word part of it, because a lot of times we'll trip over our words. We're human, we're people, and we'll find ourselves digging a hole, okay, when we don't really need to. So keeping it concise is important. And also keep it in the present. We, talking about COVID-2, we had all kinds of projections of our COVID-2, in March. And then those projections changed a few weeks later. And then the projections changed again. And there were papers that were coming out that both Meghan and Sean, alluded to. And the data that was presented in those papers, while it was current at the time, ended up changing a few months later. And so we have to keep with what we know and what is in the present. It is unwise to try and extrapolate, especially in situations like this where we've really never experienced something like this. We've never experienced this type of pandemic here in the US. And there's just a lot of unknowns and a lot of fluctuation. And then keep it to the facts as they're known. So we know things today that we didn't know in March. We knew things in March that have now been contradicted today. And so we have to keep it in the present, obviously, but we have to keep the facts as we know them. And the other thing that is important is keeping it calm. The worst thing you can do as a professional in situations like this, because we get bombarded with so much, is to panic and overreact. Because just like, I teach my students, and just as I was taught and trained, and how I try to train people now is that, risk and what you're doing, okay, what you're handling, that risk level is going to fluctuate. It's going to go up and it's going to go down. And the good biosafety officer answer is, well, it just depends. But the last thing we want to do is panic. And so early on in this, I actually sat down with all the department heads, with all the VPs, the 3 of the VPs of research, and I walked them through the risk assessment process for what would eventually become bringing students back onto campus. And so we walked through those risk assessments. We talked about them at length, got their input, and it wasn't perfect. There were things we did not know then that we know now, but the bottom line is, we as an institution, we were able to safely bring students back onto campus. And so we have students on the campus now who are enjoying a pseudo-regular semester. It's not a perfect one, but, I've I'm looking out my window right now watching students walk down the street, and they're acting like students. Okay, some of them are wearing masks, some of them aren't. They're outside, they're talking to each other, but they're going through the process. And so we wanted our students to have as much of a college experience as possible within reason. And so, keeping things simple and relatable and concise and in the present and the facts as they're known, and just keeping it calm, it goes a long way, not just for this situation, but for any, risk management situation, because I think we've all witnessed individuals who panic when things happen. So.
Yeah, and I think that just to build off that quickly, it's a lot easier to calm somebody down after they've already been calmed down a little bit. So it's sometimes good to stop and ask somebody, when you have the chance, how are you doing? And not just fine, how are you? Really saying, and look, I care here. And you can discover sometimes that, somebody's stressed about a family member or about a financial situation that may make them, without it being addressed or sort of heard, have them be less receptive to other things, and that'll just make communication a lot easier generally. And of course, those stresses can lead to you leaning a little bit more toward that skewed, statistic that you heard a few weeks ago instead of the more peer-reviewed one that you heard more recently. Great. And I just want to give a quick reminder here to our attendees that you can go ahead and use the Q&A functionality in Zoom webinar down in your Zoom toolbar to pop out a Q&A box where you can ask questions that we will address in just a few minutes here in the live Q&A portion of the webinar. So that's definitely better than the chat. You can thumbs up the questions you're most interested in, and we'll address those first. You can also respond to each other's questions. That way you don't need to wait for us to address something. Looks like there are a few questions already in there, which is great to see. And just remember that if you see something that you feel like you've encountered before or have an answer to, go ahead and type that in.
So Matt?
Yeah.
Before we move on, I just want to say I noticed Tammy made a comment that it's hard to not have our answers be interpreted as a lack of confidence or experience in this very fluid situation that we're in. I know that I find myself reminding people a lot that we are in a natural experiment. It feels kind of harsh to say that, but that's exactly what's going on. We are working through the scientific method as it happens. And so I find that talking with people that think that we're just being, wishy-washy, or we can't make up our minds, or we don't know how to make decisions, or we don't know what to do, is to simply say, we're learning new things. This is a new virus. We know things now that we didn't know in March. And I think that, just in society, the whole, and I know we probably have talked about face coverings to death, but the switch to wearing face coverings was just a huge disaster in terms of the messaging behind it, and why, and why we now know that it's effective. So I think just reminding people that we are responding to new information and better information, and, just being very open again about what we know and what we don't know, and listening to people's concerns, when people are stressed. And, I really like Trent's comment about don't panic. Because even though we're supposed to be the calm ones, I'm sure we've all had those moments of intense panic during this pandemic. And, it's just being empathetic and being human and being vulnerable with other people has been, I think, key in really making sure that everyone knows we're doing our best to keep them as safe as possible.
Yeah, absolutely. And taking the perspective as well of just saying, hey, we don't want to be holding on to the wrong information we had in the past to protect you as best as we can now. It's kind of a nice way to phrase that there. Great. Sean, next question is for you. So I was wondering how you've handled reviewing and possibly updating older risk assessments that existed before COVID to just necessarily, adopt and adapt to the new kind of COVID restrictions that get placed on research.
Yeah, it's it's been tough to really kind of negotiate the rules of it's like the rules of reopening, I guess, and with a couple of flavor changes, it's relatively the same, I'm sure, in all of our institutions. But it's a matter of trying to make sure that those can happen in an effective manner for all research processes, data collection, data processing, trying to make sure that people are cognizant of their surroundings when they're in these environments. I think one thing that can happen too, that laser focus that was mentioned earlier, I think that happens a lot with all research. And I think the thing too is, sometimes people can get back in these environments and they can sort of just get right back into the routine that they were having beforehand. And it's sort of it's a matter of reminding them that these new parameters are in place. So, what I try to do often is keep the lines of communication open with the research community here. We didn't really have a formal shutdown because a lot of researchers sort of pivoted to do some form of support for the hospital or coronavirus research. But what I tried to do is make sure that, the parameters were in place for their risk assessments to make sure that they were keeping cognizant of what these sort of new operating rules were for the institution. As that evolved, made sure those were updated, made sure those lines of communication were open. And the other thing too, I think that, has helped is, as we said earlier with, the emphasis on the risk assessment involving coronavirus, it's led to the researchers, sort of being a little more tuned to that, I think. And what I've tried to do is really communicate to them, as Meghan was mentioning, the other hazards in the laboratory, trying to sort of make sure that they're understanding that, the risks they're perceiving now, the risks they're experiencing now are risks that maybe they were a little too comfortable with before. And it's sort of giving them a chance to reassess those things and really kind of re-hone and redevelop those risk assessments. And it's funny too, it hasn't just been research too. It's been a process that I've helped adapt to the hospitals here, and the hospitals are even tackling risk assessment in a more formalized fashion, and in ways that are, extending out from just coronavirus. So I think it's given a good scaffolding for people to sort of get that, cold splash of water in the face. But it's a matter of, also directing that energy and that thought process toward everything they're doing. And I think that part's been very helpful.
Great. And is there anything else that either of you would like to add on before we move on to the live Q&A here?
I'm good.
All right. Fantastic. So before we move on, I just want to make a quick plug for our upcoming webinars. So coming up in 2 weeks, we're going to be talking about inspections, and then after that, talking about bathroom safety. This is going to be an interesting one. It's a little bit less of an open-ended discussion. I'm going to try and have more of a standard answer just about how much risk bathrooms provide. Tends not to be that much, but we'll have a aerosol specialist on to come and talk about it, which will be really exciting and arm you with good information you can take back to your organization and folks. And then our newest webinar will be about getting EHS a better seat at the table. So at a time when, EHS is needed so sorely, how can we actually make sure that their voice is heard, that their concerns are listened to, and that these decisions are not made sort of in a vacuum from the people who are experts. And these are the community connection webinars. So I've just gone ahead and launched a poll. These have been able to continue for so long thanks to all of the fantastic feedback we've gotten from you, our attendees. So knowing what topics are most interesting to you is just how we kind of find our compass towards the ones that, again, you want to watch. So hearing about what you'd like to see, we had really great feedback last time that a multi-webinar series talking about implementing some of the already known and effective strategies for, improving coronavirus safety would be a good one. So again, we know it's effective, but it's not being implemented. Coronavirus is still spreading. What can we actually do about that? Kind of trying to hit that from a few different angles. And then also, of course, The biggest limiting factor here is our panelists. We have these three folks here with us who have really generously donated their time to help facilitate this discussion, and we are always in search of more. So if you are interested or you know somebody in your network who would be a good fit, please go ahead and let me know, and I can reach out to you and we can get them on the phone and talk to them. So I'm going to leave that up for a little bit while we continue chatting and get back here. And I'll go ahead and kick it off to our live Q&A. So these will just be open to anybody to respond to. And I'm going to start out from the top. So a question here from James. He'd like to know, how has the concept of negligence impacted your approach to risk assessment? And then, of course, if anybody would like a little more.
Okay, I'll bite on this one first. I'll bite on this one first. So negligence. I don't, with me and with the way I communicate with my researchers and here in the academic setting, I'm always communicating to them. I'm always talking to them. I see them once a year for an annual review, in addition to random site visits where I just drop by the lab. So, and of course, everybody has to take mandatory online training modules, from safety to NIH, recombinant DNA, you name it, they have to take it. So in truth, they really shouldn't pull out the negligence card. If they're pulling out the negligence card, then at least for me, and I know there's differing opinions, but at least for me, that is, well, I'm going to point the finger the other way, so I am no longer accountable for the negligence I just showed. So when I sit down and do risk assessments, I do them one-on-one with the investigators. It takes us about an hour to do it. I know it's a lot of time, it's a lot of investment, but it has paid off in dividends in the short time that I've been here, because they are finally catching on that, okay, yeah, risk assessment is important. And a lot of what I get as we go through the questions, as we go through the process is, oh, I never really thought about it like that. And so for me, negligence is not appropriate, especially for professional researchers doing professional work, when they should know better. So that's just my 2 cents.
Yeah, and I definitely agree with Trent. I think it ends up being a reality sometimes with having large populations, people with all different varying backgrounds, training levels, and I think it can be a tool though, right? I think it's a situation where negligence, and again, we can call it negligence amongst our circles, not something of messaging we wouldn't necessarily use when we're conveying this to groups that we're trying to teach, but something where we're talking about failures, breaks in the system, things that aren't necessarily working or things that are being ignored, and then, use those as an opportunity to sort of point out, where things can certainly go wrong. And I think that's a tool that we definitely have in our arsenal constantly. And I think, situations of negligence give us more of those examples. Unfortunately, they do happen. Hopefully they don't become adverse events, but it's a situation where, it's a growth experience that can be used to sort of mitigate those risks from happening in the future when you educate other populations. And even to pop down to other questions down below, I think it even works with non-research populations too. It's not scared straight is the wrong phrasing, but it's sort of one of the situations where, these can be examples and learn from it, learn from the failure, learn from mistakes, and learn from these things and grow and go forward.
Yeah, I agree with everything that Sean and Trent have said. I think when it comes to helping people be compliant with the findings of a risk assessment or working with them, I think a lot of it is building those relationships, and it's a time-intensive process. It's a time-intensive process to train people. It's time-intensive to win their hearts and minds and win their trust. And, you know, sometimes scenarios can get to a point where if somebody does make a mistake, whether it's intentional or unintentional, systems can sometimes punish them for making a mistake. So I think one of the things I try to keep in mind is if something does go wrong, to avoid placing blame and trying to solve the problem, understand what went wrong, and maybe what role I had in the process, what ownership my team might have had in the process, what other systems might be involved that caused something to go wrong, versus just pointing the finger at people. To tie it kind of back to COVID, I think the compliance with face covering mandates is a great example of this, because I think part of it is people don't want to comply with it because they don't understand. And the punitive aspect of it, of going and saying, why are you a terrible person? Why can't you wear a mask? Don't you understand you're, you know, putting everybody at risk? That may not be the best approach to do that. And there's some really cool analogies between the use of face coverings and some of the measures that were put in place as part of the HIV/AIDS epidemic back in the early 80s, and trying to change people's practices. And it takes a lot of creative effort to message things appropriately to get people to buy in and be on your side. But at the end of the day, it just all comes back to building those relationships with the people you serve.
Fantastic. Going to move on to the next one here. And this is a moment I usually like. So this one is asking, Zachary would like to know, how can a business be held responsible for an individual contracting COVID in their business? I'm not sure if this actually will fall into any of your wheelhouses or experiences, and that's completely fine. This is, you know, why we have everybody on right now. So if anybody does have experience with Zachary's question and wants to chime in, you are definitely free to go ahead and do that as well. But I'll just open that up to any of you if you have anything you'd like to say on that topic.
I will say something real quick, and because we had discussions with our local Chamber of Commerce, because our extension agency here at the university is deeply involved in the community itself for obvious reasons. And so we were talking about, you know, well, how do you make customers want to come back to your store? How do you make them more comfortable? How do we communicate, you know, that we are doing everything that we can, that the state and the federal government and the guidelines are telling us to do? And so we talked about that at length, you know, things like signage and appearance inside the stores, and, you know, you name it, we probably talked about it. And so the way I put it to them is, you want to give people that warm, fuzzy feeling inside that if they step into your business, you know, they're going to feel genuinely safe, even if as a business you are enforcing, right? Just like what Meghan said, compliance with the masks, for instance, you're enforcing the mandate. But to really get to the meat of this question is, I would answer it with another question, and that is, well, how do you know you contracted COVID in their business? Okay, this goes back to things like contact tracing. And so it's going to be extremely difficult for someone to do that. Now, I'm not a legal eagle or anything, but speaking strictly from an epidemiological perspective and as a microbiologist, you know, the question is how.
Yeah, I mean, I'm not a legal expert either, so you can take this for what it is. But I know we've had a lot of, you know, discussions in terms of how do we just ensure that this doesn't happen within our building? How do we keep everybody safe? How do we make sure that we're not putting anybody at an increased risk for contracting this illness? So I think a lot of it's just trying to make sure that you're aware of what the requirements are that you're trying to meet. So, you know, what is OSHA saying that you should be doing if you're a business? What is your state saying? What is your local health department saying? I know in the state of Virginia, where I'm based, we have the governor's executive orders that lay out requirements for businesses that they have to meet in order to be open. And Virginia has become the first state to pass safety regulations related to COVID-19 and what employers are required to do to protect their employees. So I think that I'm not sure what the case law will look like after this pandemic or what will happen related to it. But I think in terms of making sure that you're protecting your organization is just to make sure that you are following all of the guidelines, all of the best practices, all of the requirements as best you can in order to protect your employees and any visitors that might be coming into your business.
Great. All right, and another question here from Joan. Joan would like to know, how do you or are you teaching non-researchers how to conduct their own risk assessments? For example, custodians and trades personnel.
Yeah, I mean, I could say we've been doing this extensively because we've been operating a lot of different facilities with a lot of people that are not necessarily scientists operating in these environments. And I think, one of the things we've been trying to convey when conveying risk assessment is trying to frame it in a way that is accessible. I think, the concept of risk assessment is something that people do every day and don't even realize it. Even the idea of crossing the street, crossing the street looking both ways, that's a risk assessment. And I think trying to convey what are the goals of a risk assessment, underlying what is occurring in the event that's occurring, what the risk is actually in that situation, and then how to mitigate that risk and lower that risk in whatever you're doing. And, we try to convey that to people in all of these different fields because they do operate in areas that do have a lot of inherent risks themselves. But I think we've been trying to emphasize that because, we have crews that are in here overnight. They're in environments where, they're not under a watchful eye. How is compliance with social distancing? How is compliance with face covering? How is compliance with congregating in groups? And it's not something where you can have like a hall monitor sitting everywhere, saying, hey, put that mask on. Hey, get 6 feet apart with like a ruler or something like that. It has to be a culture. And I think we're trying to build that culture out, which I think could be a benefit after this is all over too, where everyone's sort of feeling that and thinking in that mindset throughout their day-to-day lives.
All right, great. Coming up next, we have a question here from Dina Siegel asking, how do you answer a researcher who says, why do you need to have that in the risk assessment? When I say I'll follow all the biosafety rules or use the most stringent controls, why do I need to give you the details of what I'm working with? So people who are maybe a little bit reluctant to really engage with the risk assessment process.
I'll start it off. I try to scare folks. I think that's I know it's probably tactic a lot of people use. I try to scare them. They sit there and they say, oh, I know all that stuff. I'm like, oh, well, what do you do if this happens? All right, what do you do if this happens? And I try to throw some complex scenarios at them that kind of baffle them in a way. They're like, and then we can start getting to the root of it.
Yeah, I mean, I've also resorted to kind of giving them scary scenarios. I oftentimes, especially if you're dealing with a PI, sometimes I gently remind them about what happened to UCLA with Sherry Sanji, and that there could be liability for them if they're not doing everything they can to protect the people that work for them. I try not to pull that out as much. I try to sweet talk them first, and just kind of spend time to understand. And I think sometimes I found if you come in and you're like, all right, today we're going to do a risk assessment, let's go. They are less likely to engage with you if you instead say, hey, I saw that you had this paper published. Can you tell me more about the work that you did? Oh, why did you do it that way? Oh, how did you do that experiment? So maybe kind of go like a little bit twisted and get them just talking about the science. And then you can start, as they get more comfortable telling you about what they're doing, then you can ask more targeted questions about what it looks like and why you need to do it. But sometimes you have to know the personality of the person that you're dealing with too, to understand what the best approach is to handle their reluctance to engage.
Yeah, and I think kind of to get back to your point about having risk assessment be a collaborative process, Researchers are often afraid that risk assessments will get in the way of them doing the research they want to do, or it will make it notably harder or more difficult, especially for processes that are highly repetitive. Adding in a couple extra steps, doing something that adds a few seconds when you're doing the same process, you know, hundreds or thousands of times is pretty challenging. So just, you know, again, reminding them, hey, I'm here, I'm on your side. Maybe reminding about, you know, what time looks like if an incident does happen, perhaps might be a good way to have them remember that a couple extra minutes here or there is maybe worth it.
Yeah, I think oh, sorry.
Nope, go ahead, Megan.
I was just going to say, it's that point too. I think part of the, sometimes when you're getting down to, you know, the perception that you're trying to throw up, you know, blocks to their research, it is kind of hard to overcome. So something that we've been able to do at Janelia is really make sure that we are doing what we have to do in the most efficient way possible. So just a general piece of advice, as you look at your processes and you look at your policies and you look at your procedures, really make sure that everything you're doing has a genuine purpose and a genuine intent, is adding value, and that you're trying to stray away from some of that self-imposed regulatory burden that can sometimes happen when you're trying to meet regulations. So just, you know, in addition to building those relationships with researchers and gaining their trust, also make sure that you're kind of looking inward at your own operations so that they are as streamlined and efficient as possible.
Sorry, no, what I was going to say is I think each of our approaches is a little bit different, all to the same end for me, because I actually, when I receive, so I get all the protocol applications for the IBC, and I review them and I go through them, I send them back, and then I use the direct approach, and that is, okay, now I need to schedule a time when we can sit down and do a risk assessment together. And I have actually gotten the question, well, why do we need to sit down and do a risk assessment? Well, we need to see, you know, you're doing this body of work. So we need to make sure that what you're doing, that you have thought of, you know, the necessary questions that are associated with the work from a safety perspective, not from a method perspective, but from a safety perspective, just to make sure that we're not missing something. And so, and when you approach them one-on-one and sit down and talk to them, you know, like adults and like scientists to scientists, they open up. And then you do get the questions, well, or the statements of, well, I never really thought about it like that before.
Yeah, getting those moments where there's, you know, for any better word, intimacy and vulnerability, where people can say, oh, I was wrong, or, oh my gosh, I hadn't even thought about that as a possibility, or, oh, you know, sure, it's just a cut, but it'll be fine. They don't think about what that cut might mean in terms of an exposure or the administrative hell they have to go through. Those are valuable moments, definitely. So anything you can do to get those is really great. Coming up next, we have a question from Chris here asking, how do you approach balancing the risks we're used to thinking about of working alone with the infection risk of putting people in close contact?
I think PPE and process can sort of help mitigate that. You know, not a direct laboratory research example, but we, you know, when we're going through the reopening plans for our medical and professional medicine schools, you know, we're going through all these practical classrooms. You know, they had physical therapy, occupational therapy, gross anatomy. You have a lot of environments where, you know, students are traditionally part of their curriculum, very hands-on, you know, dealing very interactive. One of the students pretends to be a patient, or they're all hovering closely together over an organ or a system within a, you know, an anatomical gift. So these were hard situations to try to mitigate that risk. You know, what we tried to accomplish was really conveying, you know, visualizing how can we accomplish these things that we know are mitigating the risks of coronavirus, things like the social distancing, proper personal protective equipment, and doing that stuff. So I think it was trying to really penetrate the mindset and keep those sort of three tenets in mind whenever they're operating in those environments. And, you know, to a lesser degree, we haven't had a ton of issues with overlapping within our laboratories, because a lot of our laboratories are, you know, BSL2, BSL3, wearing a lot of personal protective equipment already, not a lot of that, you know, intimate workspace area, but still trying to convey keeping those three tenets really in mind whenever they're doing any sort of assessment of the work that they're going to be performing. So that's been really the hard thing we've been trying to really accomplish throughout all of our environments.
Just to build off that, a personal question that I'm sort of interested in is, have any of you had to deal with navigating risk assessment for work that kind of requires two people to be in close proximity? You know, we touched on this a little bit back in our facilities webinar, but you know, those protocols or experiments where you may need two people for a complex tissue culture or maybe mouse work, something where it's just sort of hard to avoid and still do the experiment. Do you rely on maybe giving out some very precious N95s or sort of avoiding the work? Is that something you've experienced?
I don't have a great example, but I know that we've talked to our vivarium staff, which is where most people are likely to have to work within 6 feet of each other in our facility. And the guidance I've given them is, you know, follow all the practices that we're asking you to do. Make sure you're wearing the surgical mask that we provide you. Make sure that you are minimizing the amount of time where you're within 6 feet of each other. You know, do your best to, you know, make sure that you're not sick when you come into work, you know, go through that screening, all of those processes and procedures that we have in place. If we get into a situation where we have two people that need to be within 6 feet of each other, we already have a great base to work from to kind of minimize the risk for them. And then, you know, if we get into a situation where they're finding each other, you know, needing to be close for really long periods of time, we will make determinations about, well, do we need to change from a surgical mask to an N95, as you mentioned, or a KN95? Or do we think this is sufficient based on the surgical masks that we're using? So unfortunately, the best measures that we have in those situations are going to be, you know, the PPE that we ask them to wear and what they're putting on their bodies. But, you know, we've let them know that if they are finding themselves in that situation frequently, that we want to have discussions with them to see if there are alternate ways to achieve what they need to achieve without needing to be within 6 feet of each other. So it's kind of like that. You need to scientifically justify why you have to be within 6 feet of each other to do this. Like, it can't just be because it's easy and how you've always done it. Like, if there's another way you could accomplish this, let's talk about it. Let's work on it and figure out if there's a better way to do it.
So I'm just gonna jump in real quick here. All of a sudden it's 3:02 p.m. Sorry, 4:02 for a lot of you. So it's is the time that our webinar is scheduled to end. You know, we do check with our panelists ahead of time and just see if there's a possibility for them to stay on for an extra few minutes as we answer the remaining questions. But also, of course, things come up. You know, we are in health and safety, and emergencies happen and things change. So if anybody has to jump at this point, big thank you for joining. And of course, if you don't, big thank you as well. So I just want to check with everybody to make sure, see if you're able to stay on or not.
I can stay on for a few more minutes, Matt.
Yep.
Okay. Fantastic. Next question up here at the top. Nick would like to know, how does legal liability affect the risk in regards to colleges offering in-person classes? So again, this may be one of those that's a little bit outside of the risk assessment profile that we're talking about here or in your portfolios, but just wanted to check and see before we kind of open that up again to everybody else here to see if you have any expertise on that one.
So I can speak. Oh, Trent, go ahead. You go first.
What I was about to say, and it's probably similar to you, is that, you know, the state of Mississippi decided that they were going to bring classes back onto campus. They were going to have, you know, some on-campus classes, some mixed learning classes, and some just sole online courses. That mandate to do that and to bring that back came from the governor and came from the IHL. So the governor established several task forces amongst all the universities that are in the state of Mississippi. They developed a solution proposed the solution, and then they pushed out the solution. I know I wasn't involved. I just know people who were in the midst of all that. Yes, they were assessing risk, they were managing risk, they were accepting whatever residual risk they wanted to accept in order to allow classes to resume. And so as far as legal liability is concerned, you know, the state of Mississippi and the governor and the universities themselves, you know, they're absorbing that liability in and of themselves by allowing the universities to have on-campus courses again. So I know they've worked through all of that, and now we just, you know, time will tell. That's all we can say, or that's all I can say. And go ahead, Sean.
Yeah, so what we, similar to that too, what our entities here in New Jersey, we actually had to, each entity of higher education had to submit a reopening plan and a phased reopening plan for in-person classes. It was very comprehensive. I mean, down to how you and when will you disinfect hard porous surfaces, what are your contract tracing plans, your wellness check plans, health services representatives, things like that. So once that plan is put together, it actually has to receive approval from the New Jersey Office of the Secretary of Education. So when that plan reaches their plate, they read it, they review it, and then they give their sort of go ahead. There's obviously tons and tons and tons of lawyers involved before that plan is actually submitted to the Secretary of Education. And I can tell you it's a very stringent process. You know, we have a few entities that we operate within, and a few of them actually had plans that were, you know, rejected and had to be revised and sent back and changed appropriately. So a lot of good eyes on it, a lot of people and a lot of diligent thought put into place to make sure that, you know, all parameters are met for, you know, a safe process, and knock on wood, it's been working so far.
Yeah. Yeah, it was the same thing here. Every university, you know, when I said task force, every university had one. They were developing exactly that, the, you know, the phased reintegration plan, and it had to pass muster. And actually just, I guess it was last week, we had members of the IHL and the governor come and do an on-site inspection of Mississippi State to see if the plan that was approved was actually working.
All right. Coming up next, we have a question here from Kathleen. Kathleen would like to know, how do you frame the concept of low risk versus no risk? You know, that we've reduced the risk to what would generally be considered low and thus acceptable, but not necessarily eliminated it, especially for those people who are particularly risk averse. And just to add on my own comment here, with coronavirus causing so much stress in terms of health and safety, generally, and also financial anxiety, anxiety does tend to really multiply those feelings of risk aversion, and sort of breaking through that a little bit when people find out that, yes, there is going to still be some risk present, regardless of controls.
So I'm going to take a stab at this real quick, just coming from a military perspective, because we deal with risk all the time, infectious disease and otherwise. We don't call it low risk and no risk. We term things, we frame things in terms of things like initial risk and acceptable risk and residual risk, right? And when I teach my students, much like Sean was saying, you know, when you cross the street, you're accepting, you're taking on a certain amount of risk. The example that I use when I'm talking to, you know, whether it's lay people, custodians, bus drivers on campus, or just friends, okay, I use the example of, do you buckle your seatbelt when you drive? Because if you buckle your seatbelt, you're still accepting risk, okay, that you may drive and you may get into an accident as soon as you leave. You've buckled your seatbelt thinking in your mind that, well, this seatbelt will, at least if I do get in an accident, it'll at least hopefully keep me alive. And so at the end of your mini risk assessment process that you do when you buckle your seatbelt, you have accepted a certain amount of residual risk associated with driving in a car. So, so from my perspective, it's not so much low risk and no risk. It's more initial risk and acceptable risk and residual risk, because we all accept certain levels of residual risk in our everyday life.
Yeah, I really like how you explain that, Trent. I'm going to use that now moving forward. But it's similar. I've been telling people we can't get rid of this risk. This is not something we can completely remove, but we've done everything we can to reduce it as much as possible. So it's, I don't try to compare things low risk or no risk. It's we've reduced it. We haven't gotten rid of it, but we've just reduced it. And after that, it's having a conversation with them to understand how they're feeling about the reduction in risk, right? Because as Matt mentioned, anxieties are running high right now. Everyone's kind of on hyper alert all the time. And, it's been really difficult to deal with the onslaught of news stories and changes and social unrest and everything that's been happening in the world over the past 6 months. So a lot of it is if someone is being particularly risk averse about a measure and they don't want to accept the risk, it kind of becomes a conversation of, what are your concerns? How can I help you work through your concerns? Is there anything else that you think we should be doing that we're not doing that we could do to protect you? And that's a little bit easier in a situation when you're working in a smaller institute, because you have those relationships with people and you're able to attack things more personally. But I find that having conversations and really understanding why people are concerned helps explain things to them in a way that makes more sense.
Yeah, I would just add to that. I think a lot about connotations for these sorts of things, because I think that risk is a word that carries a lot of negative connotation. When you think about a risk, you don't think of the risk of a good thing happening. It's always the risk of a negative outcome. And sort of risk opportunity are two sides of the same coin, in that at some level, when you try to bring risk down to zero, you also bring opportunity down to zero. So thinking maybe rather than focusing solely on this sliver of a negative possible outcome, trying to guide them towards, well, but think about all the positive things that can happen now because this is happening. Sure, there's a small risk, but look at this large opportunity, and that those are very tightly tied together. Kind of help to also deactivate some of that fear center and instead get people thinking about, oh yeah, I do want this thing. I'm not just afraid, like doing this thing because I'm afraid of it and I have to. I'm doing this thing because I want to.
Well, yeah, Matt, I think that's perfect, right? It's mitigation. I think it's explaining the mitigation piece as well as the risk piece. Just to tell a personal story too. I had family members that have had, hundreds of these conversations since, things started earlier in the year, and, conveying the idea of risk assessment, and then, the acceptable risk within the scenario they're discussing, whether it be meeting with these people, bringing these people into their quote unquote bubble, that sort of thing. We talk through the risks, talk through what could occur. And, recently, had a family member that, things went wrong, and it didn't go wrong in a very traumatic way, but it went wrong where the risk was realized. And, exactly to what you just said, Matt, I think it's, it should be a learning experience. It should be an evolution experience, and furthering developing that risk assessment and developing those mitigation tools. Because the second risk is realized and, that worst case scenario happens, it shouldn't be a situation where, all right, that's it, we're done. It could be, but I think it needs to be a situation where you evaluate everything that's occurring, and then how can the situation grow, and how can our tools be, further developed to further the process and to grow from that experience. I think that's so vitally important.
Yeah, it's so funny just having all of a sudden the world being versed in risk and that concept. And seeing people struggle with that and all of a sudden thinking, I've been trying to tell you this the whole time.
It's true. It's so
Mhm.
true.
Great. Well, we are just out of time here. This hour and 15 minutes really blazed by. I wanted to thank everybody here for their time and their expertise. Really fantastic webinar today. Another quick plug for our upcoming webinars. We've got try to keep 3 on deck at all times. And of course, if anybody is interested in being a panelist, if you have any ideas about webinars you'd like to see, I'd love to hear them. And a huge thank you to our 3 panelists for their time today. It's finding time for any project during this crazy time is very difficult, and really appreciate you joining us and talking for so long to help facilitate these discussions. So big thank you, and we'll see everybody in 2 weeks.
All right. Thanks, Matt. We appreciate it.
Thank you, everybody.
Bye, everyone. Take care.
Bye, guys. Have a good one.